Vitamin B6. Vitamin B6, or pyridoxine, is a water-soluble vitamin found naturally in many foods, as well as added to foods and supplements. Pyridoxal 5-phosphate PLP is the active coenzyme form and most common measure of B6 blood levels in the body. POP is a coenzyme that assists more than 100 enzymes to perform various functions, including the breakdown of proteins, carbohydrates, and fats, maintaining normal levels of homocysteine, since high levels can cause heart problems, and supporting immune function and brain health. Recommended amounts. RDA. The recommended dietary allowance, RDA, for men ages 14 to 50 years is 1.3 mg daily, 51 years. 1.7 mg. The RDA for women ages 14 to 18 years is 1.2 mg, 19 to 50 years, 1.3 mg, and 51 years, 1.5 mg. For pregnancy and lactation, the amount increases to 1.9 mg mcg and to 0.0 mg, respectively. UL, a tolerable upper intake level UL, is the maximum daily dose unlikely to cause adverse side effects in the general population. The UL for adults 19 years and older is 100 mg daily, with slightly lesser amounts in children and teenagers. This amount can only be achieved by taking supplements. Even higher amounts of vitamin B6 supplements are sometimes prescribed for medical reasons, but under the supervision of a physician, as excess vitamin B6 can cause toxicity. Vitamin B6 and health. Vitamin B6 has been widely studied for its role in disease prevention. The vitamin in supplement form shows the most promise for the treatment of pregnancy-induced nausea, but such use should only occur under the supervision of a physician. Adequate blood levels of B6 may be associated with lower risk of cancers compared to low blood levels. However, the use of separate B6 supplements apart from the RDA amounts in typical multivitamin preparations is inconclusive and not recommended. Food sources. Vitamin B6 is found in a variety of animal and plant foods: beef liver, tuna, salmon, fortified cereals, chickpeas, poultry, some vegetables and fruits, especially dark leafy greens, bananas, papayas, oranges, and cantaloupe. Signs of deficiency and toxicity. Deficiency. A vitamin B6 deficiency most often occurs when other B vitamins in the body are low, particularly vitamin B12 and folic acid. A mild deficiency may have no symptoms, but a more severe or prolonged deficiency can exhibit the following: microcytic anemia, skin conditions, depression, confusion, lowered immunity. Certain conditions can increase the risk of developing a deficiency by interfering with the absorption of vitamin B6, kidney disease, autoimmune intestinal disorders like celiac disease, ulcerative colitis, and Crohn's disease, autoimmune inflammatory disorders such as rheumatoid arthritis, alcoholism. Toxicity. It is quite unlikely to reach a toxic level of vitamin B6 from food sources alone. Vitamin B6 is a water-soluble vitamin, so that unused amounts will exit the body through the urine. However, a toxic level can occur from long-term very high-dose supplementation of greater than 1.0 mg daily. Symptoms usually subside after stopping the high dosage. Symptoms include neuropathy in feet and hands, ataxia, loss of control of body movements, nausea. Cognitive function. Vitamin B6 may indirectly help with brain function by lowering levels of homocysteine, as high levels of this protein in the body have been linked with a higher incidence of dementia, Alzheimer's disease, and cognitive decline. However, There is a lack of controlled trials showing that supplementation can slow cognitive decline. A Cochrane review looked at 14 randomized controlled trials that evaluated the cognitive effects on people who used B vitamin supplements for at least 3 months. 6. It did not find an effect of the supplements B6 alone or in combination with B12 and folic acid on cognition in older adults 60+ years without dementia at baseline, compared with a placebo. Cancer. A systematic review of both epidemiological and clinical studies looked at the relationship of dietary intake or blood levels of vitamin B6 and all cancers. The epidemiological studies found that a high intake of vitamin B6 foods and higher B6 blood levels were significantly associated with a lower risk of all cancers, most notably gastrointestinal cancers. However, when total B6 intake from food and supplements was assessed, the protective effect weakened. The clinical studies did not find a protective effect of B6 supplements, but the quality of these studies was rated low, because B6 was not given alone and because cancer was not the main outcome studied. The authors concluded an unclear role of vitamin B6 in cancer prevention. Because of the discrepancy between results from epidemiological and intervention studies, they suggested that higher levels of B6 in the body may reflect the status of other nutrients that are protective against cancer. Vitamin B6 is believed to play a role in colorectal cancer through its enzyme activity that may reduce oxidative stress and the spread of tumor cells. Vitamin B6 deficiency is associated with chronic inflammation, a risk factor for colorectal cancer. A meta-analysis of epidemiological studies did not find that B6 supplements reduced colorectal cancer risk. 8. However, when measuring pyridoxal 5-phosphate PLP blood levels, participants who had higher PLP showed a 30 to 50% reduced risk of cancer. The authors noted potential confounding factors in these studies, such as healthy lifestyle behaviors, higher level of exercise, no smoking, higher intakes of other vitamins that could have protected against colorectal cancer. 2 prospective studies of men and women from the Physicians' Health Study and Nurses' Health Study cohorts found a protective effect of higher PLP blood levels and B6 intakes from food and supplements on colorectal cancer risk. This result remained after adjusting for intakes of folate, multivitamins, and methionine nutrients that may be protective against colorectal cancer. Morning sickness. Vitamin B6 has long been documented as a remedy to help relieve pregnancy-related nausea and its most severe form, hyperemesis gravidarum, which sometimes necessitates hospitalization due to severe dehydration. A blinded randomized controlled trial of 77 pregnant women found that 40 milligrams of vitamin B6 taken twice daily reduced the severity of mild to moderate nausea compared with a placebo. A review of randomized controlled trials showed that vitamin B6 supplements up to 10 milligrams daily was associated with improved symptoms of mild pregnancy-related nausea compared with a placebo. 12 for moderate to severe nausea. A combination of vitamin B6, undoxylamine and antihistamine, taken preventively before symptoms started, was more effective than taking it after the nausea started. Over-the-counter vitamin B6 and B6 with doxylamine are recommended as safe and effective first-line treatments for pregnancy-related nausea by the American College of Obstetricians and Gynecologists. Introduction. Vitamin B6 English. Vitamin B6 is a kind of B vitamins, also known as anti-dermatitis vitamins. Pyridoxine, widely distributed in food, is closely related to the metabolism of amino acids. Amino acid decarboxylase, transaminase and other coenzymes This is a water-soluble vitamin that is easily lost during cooking. The symptoms of animal lack of vitamin B6 are dermatitis, delirium, anemia, etc. Simple vitamin B6 deficiency is rare in humans. Vitamin B6 mainly acts on the body's blood, muscles, nerves, and skin. Functions include assisting in the discharge of nitrogenous wastes, the synthesis of antibodies, the manufacture of stomach acids in the digestive system, the use of fats and proteins especially when weight loss is needed, and the maintenance of sodium, potassium balance, stabilizing the nervous system. The lack of vitamin B6 in the general disease, the general lack of appetite loss, low food utilization, weightlessness, vomiting, diarrhea and other problems, severe lack of acne, anemia, arthritis, child moles, depression, headaches, hair loss, inflammation, learning disabilities, weakness. Safety. Adverse effects have been documented from vitamin B6 dietary supplements, but never from food sources, even though it is a water-soluble vitamin and is excreted in the urine. Doses of pyridoxine in excess of the dietary upper limit (UL) over long periods cause painful and ultimately irreversible neurological problems. The primary symptoms are pain and numbness of the extremities. In severe cases, motor neuropathy may occur with slowing of motor conduction velocities, prolonged F-wave latencies, and prolonged sensory latencies in both lower extremities, causing difficulty in walking. Sensory neuropathy typically develops at doses of pyridoxine in excess of 1,000 mg per day, but adverse effects can occur with much less. So intakes over 200 mg per day are not considered safe. Trials with amounts equal to or less than 200 mg per day established that as a no observed adverse effect level, meaning the highest amount at which no adverse effects were observed. This was divided by 2 to allow for people who might be extra sensitive to the vitamin, referred to as an uncertainty factor, resulting in the aforementioned adult UL of 100 mg per day. This information is collected from different places and is only an informative video for you, and not a treatment method. Every day, there will be a new video. Please subscribe so as not to miss.